In your opinion, how does a process like this improve diagnostic accuracy or clinical outcomes?
As an expert, we're able to sometimes look beyond the obvious. Many cardiac cases revolve around a patient having chest pain, and of course the first thing we think about is chest pain is due to ischemic heart disease, but of course chest pain can be due to many different factors. And by having the full history that goes back sometimes many years, we can many times come up with a differential diagnosis and a much more obvious cause of chest pain. Recent case that I saw was a patient who had recurrent chest pain. Stress tests were normal, angiograms were normal, but one angiogram showed that when the catheter was placed in the artery spasmed a bit around the catheter, and the patient had been diagnosed with coronary artery spasm. But we know that sometimes that can just be catheter-induced and is not really spasm. And so this patient was on a lot of treatment trying to prevent spasm, none of which was working and causing the pain. And so by looking very carefully through the history and through all of the data, we were able to pretty definitively say this was not coronary spasm, and it was due to other processes that the treatment could then be refocused. So I think by having all the data in front of us and going back sometimes many years and sometimes across a number of different physicians, we can come to a more precise possibility of what the cause of the symptoms are.